Hello, my name is Dr. Brian Raid, and I am a naturopathic doctor. And this is a video about treating patients or therapeutic considerations for patients who have a diagnosis of small intestine bacterial overgrowth, but they are very, very sensitive. In my practice, where a very large proportion of my practice is treating patients with complex chronic illness, so patients suffering from borreliosis, which causes Lyme disease, co-infections of Borrelia, mold illness, heavy metal issues, methylation issues, different types of chronic dysbiosis, etc. I've accumulated a lot of patients over the years who are very, very sensitive, like literally hundreds and hundreds of patients who are just very, very sensitive. And by sensitive, I mean that they're sensitive to treatments that they might work with. So they might come in saying, I tried to use antibiotics to get rid of this persistent borreliosis that I'm suffering from, but I couldn't even tolerate, half of a normal dose. I would just flare and flare and flare. Or I've tried working with herbs and I just flare and flare and flare. It seems like it's really hard for me to tolerate any, sort of an average dose. And so with those patients, it becomes very important to make sure that we're working within the confines of what their physiology is able to tolerate and deal with. And talking about why the heck people are sensitive in the first place is just a whole other discussion. But for patients who are very sensitive like that, and specifically if they're dealing with small intestine bacterial overgrowth, then some of the things that I found to be the most useful is starting with really, really low dose herbal formulas and increasing the potency of those over the course of time as is tolerated by the patient. We can usually get away with working with diet pretty easily, going on a SIBO unfriendly diet, which should largely be minimizing complex carbohydrates and possibly certain other things. Most people can tolerate that pretty well. That being said, I've had some patients who are so sensitive that if they go on a SIBO unfriendly diet too quickly, then they find that their symptoms might actually flare up from that. So we have to sometimes be careful. It's like, okay, I usually say try to do the diet about 80% of the way. If you can achieve 100%, that's wonderful, but just you got to live your life, and 80% is pretty darn good for most people. And so some of those really sensitive folks, I might have to say, like if they say, yeah, I tried to do the diet and I'm just feeling worse, there can be other things beyond, say, aggressive SIBO die-off that might be driving those symptoms. But if it's not one of those other things, like they're just not eating enough, so they're feeling bad, or they have the type of physiology where they need more carbohydrates than a person with, say, like a slower metabolism, like there's certain troubleshooting things that way. But sometimes it seems it's actually due to microbes dying off too quickly. So in those cases, I might say, try to do the diet like 50% of the way and see if you tolerate that. So they'll be intentionally eating SIBO promoting foods to some extent to try to mitigate the die-off. With that being said, that's very rare. So in patients where they're doing the diet, but they're having a hard time tolerating the antimicrobials, then in my experience, what oftentimes is one of the most user-friendly things to do is to work with herbal tinctures. Tinctures are basically alcohol extracts of herbs. And the nice thing with tinctures is that we can start patients off with as little as 1 drop of the formula, where a therapeutic dose would oftentimes be, around, say, a teaspoon per dosage or half a teaspoon, or kind of depend on the patient and whatnot. And a teaspoon is approximately 120 drops. So sometimes we're starting with 1 drop. And so they're at a very, very low dose. And sometimes we'll start at 5 drops or 10 drops. It depends on their level of sensitivity. And then we might need to build up by another drop or 5 drops or 10 drops, whatever the increment is, every 1 to 7 days sometimes. Sometimes we really have to squeak it up. But I've had many patients over the years now where they came in, we tried them on a higher dose to start, and even like, say, 30 drops, for example, to start, and they flared. And so then we drop them down to 1 drop or maybe 5 drops, and they find, okay, I can tolerate that. And then they just build it up incrementally. If they find that they're starting to feel worse as they're building up, then they back off, let it marinate for, settle there for like maybe a day or 2, maybe 3, and then try bumping it up again. And I've had many patients where initially they couldn't tolerate any tincture at all, and they are able to get up to the full dose over a period of time. The subtext there is that it usually does make the treatment process slower, but at the end of the day, if you can't tolerate the full dose treatment, it's kind of either suffer and probably you can't really muscle through something like that. So it's either like don't get treated or do it in a more methodical way. One other potential option for those patients would be working with something called an elemental diet. With an elemental diet, it basically involves consuming no solid food, but only an elemental diet formula, which is basically a powder that you buy. There's several companies that offer this now. Virtually all of them, it has to be provided through a clinician, so not something you can just go buy online as a general rule. And basically in that formula, it's primarily composed of maltodextrin, which is it's a simple sugar, but it's a type of sugar that's not usable by the SIBO bacteria. There's also these free amino acids, which are kind of like pre-digested proteins. So, and then there's some fat in there as well. Usually in the form of safflower oil or sunflower oil, and then a bunch of vitamins and minerals to try to make up for the absence of those nutrients if you're not eating solid food. And so the idea with the elemental diet is that it's basically a meal replacement therapy, but everything in the powder is the SIBO is not able to utilize it for food. And so you're basically starving out the SIBO very aggressively by just completely nutrient depriving them. And an elemental diet would typically be done over 2 or 3 weeks. There's only been a couple of human clinical trials looking at the elemental diet to date as it relates to SIBO, but those studies do show fairly impressive results. After 2 weeks, about 80% of the participants in the study tested negative on their follow-up breath test. After 3 weeks, that number shot up to, I believe it was about 85%. So it's quite an impressive number. Just there are certain challenges with the elemental diet. If it's something that you'd like to learn more about, there's a really fantastic resource on the website of Dr. Allison Seebecker. She's a naturopathic doctor from Washington, if memory serves, or Oregon, or I don't know, somewhere in that neck of the woods in the States. And she has a website at siboinfo.com, and she has tabs at the top of her website. And if you just click on the one for, I think it's therapies, and then it drops down to elemental diet, it's pretty easy to find. She has 3 different videos on there talking about why you might do the elemental diet and challenges with implementing it and kind of troubleshooting those challenges. So it's a really good resource. I recommend it to my patients as a rule when they're embarking on the elemental diet. So that can be a really good option for really sensitive patients. And it certainly isn't the most fun diet to work with, and there is cost associated with it as well, but it's something that can be an option for those really sensitive, really tenacious cases. There are other possible therapies that might be indicated too. Sometimes we need to use immunotherapy, like low-dose immunotherapy, to address a sensitive case of SIBO. Sometimes we'll use not tinctures, but powdered herbs just in lower dosages and gradually building them up. There's different avenues that can be worked with, but those are some thoughts to think about around sensitive cases of SIBO.